Sathyabama Institute of Science and Technology.
Good morning to everyone. I'm Jancy Mary, Assistant Professor, Department of Biotechnology, Sathyabama Institute of Science and Technology, Deemed University. Today we will discuss about the topic glycogen storage diseases. So, the metabolic defense concerned with glycogen, that is the synthesis and breakdown of glycogen, is called as glycogen storage diseases. This disorders is defect in that enzymes. The inherited disorders are characterized by normal and abnormal type of glycogens. So there are main types are seven types, type 1, type 2, type 3 so far. But type 1, it is also called as Vanchiak disease. So it is transmitted by autosomal recessive triad. The main enzyme deficiency of this Vanchiak disease is glucose 6-phosphatase enzyme. The enzyme is absent in liver cells, intestinal mucosa, renal tubular mucosa. They are all loaded with glycogen, which is normal in structure but metabolically not available. So the clinical and biochemical manifestations are fasting hypoglycemia. So hypoglycemia is nothing but decreased insulin secretion, which in turn inhibit protein synthesis. Lactic acidemia. Lactic acidemia, the glucose, it is produced in muscle and liver. So the lactic acidemia is lactose content is increased. Hyperlipidemia, the lipid content, that is excess of acetyl-CoA, that increase the lipid content or cholesterol level. Hyperuricemia, the glucose 6-phosphatase enzyme that accumulate in HMP shunt pathway, automatically the uric acid level is increased, that is called as hyperuricemia. Second type is POMS disease. The main enzyme deficiency of POMS disease is lysosomal alpha-1,4 glucosidase. This enzyme mainly involved in enlargement of heart, nervous tissue. So the clinical and manifestations are no hypoglycemia, but the death occurs due to heart failure. Next is type 3 cori's disease. This disease is also called as FOBS disease. So the enzyme deficiency is amylo 1,6-glucosidase. The main organ affected are liver, muscle, heart, leukocytes. The clinical and biochemical manifestations are hepatomegaly. The branched chain glycogen accumulates. It leads to hepatomegaly. Other than that, the clinical symptoms like Vanchiak disease similar, that is hypoglycemia, hypouricemia, hyperlipidemia. Type 4 Anderson disease, that is also called as amylopectinosis. The enzyme deficiency of the disease is glucosyl 4,6 transferase. So the glycogen deposited is abnormal. Glycogen with only few branches are accumulated. The main organs affected are liver, heart, muscle and kidney. So the clinical symptoms are hepatomegaly, it is due to enlargement of liver. Other than that, hypoglycemia, cirrhosis of liver, hepatic failure, usually fatal. Type 5, that is also called as MC Ardle disease. The main enzyme deficiency is muscle glycogen phosphorylase. So the glycogen deposited is normal in structure. The main organ is involved is skeletal muscle. So that's why the name is called muscle glycogen phosphorylase enzyme. The clinical manifestations are muscle cramps on exercise, pain, weakness, stiffness of muscle. No lactate is formed in this disease. Muscle may get damaged. Sixth type is Hirsch disease. The main enzyme deficiency is liver glycogen phosphorylase. So the glycogen deposited is normal in structure. The main organs involved are liver. So the clinical and manifestations are hepatomegaly. It is due to enlargement of liver. Hypoglycemia. It is due to insulin level, changes in insulin level, and mild acidosis. Liver glycogen cannot form glucose. Type 7 is also called as Taurus disease. The enzyme deficiency is phosphofructokinase. The main organs affected are skeletal muscle. So the accumulation of glycogen in skeletal muscle, glucose 6-phosphate and fructose 6-phosphate is also accumulated in this disease. The clinical and biochemical manifestations are muscle cramp. Type 7, that is 7 types are most important diseases. Other than that, one disease is called type 8. The enzyme deficiency is hepatic phosphorylase kinase. So in this hepatic glycogen phosphorylase activity, it decreases the glycogenolysis process. So the clinical and biochemical manifestations is hepatomegaly. Other than that, mild to moderate hypoglycemia. Thank you.